Uh, specifically in regards to weight maintenance and management, I guess.
Yeah.
The other thing is, as you know, there are some HHS priorities. You mentioned one of them, obesity, substance abuse, probably the
Mhm.
mental health, specifically depression and anxiety, and the history of trauma that you also mentioned. Is this related to history of trauma in childhood? We've been doing a couple of activities with SAMHSA, and I'm not sure if there is only to address it in childhood, or if address the trauma in the adult population too.
Yeah, and I would say again both. I mean, ideally in childhood, preventing it in the first place or intervening early is really a key opportunity. But also in adults with that history of trauma, which sometimes is childhood trauma, sometimes maybe trauma that happened in early adult or adulthood, and often it's both. Once people have experienced trauma in childhood, they're more likely to experience that again, and um, and then that has a big impact on their medical problems and their long-term longevity. But really focusing on resilience and how do we help foster resilience in people who've experienced that, um,
Hmm.
and to not re-traumatize people in the medical setting, which sometimes happens.
Now, in regards to social determinants of health, there is a topic area that we have to develop, and specifically is regarding promoting health equity and reduce social determinants of health. So, is there any social determinants of health that you believe is impacting specifically the population that you are serving?
Yeah, I mean, so many of them, right? I mean, it's really on multiple levels
Hmm.
and maybe slightly different with people. I mean, definitely immigration is a huge concern
Yes.
right now.
Hmm.
I mean, there's tremendous amount of stress in communities. I would say that's probably the number one stressor that we see. But of course, housing is a big impact. Uh, Depending on what happens with healthcare, access to healthcare might become a rising priority, although it has not been a problem for us recently. But food security, as far as healthy food, access to healthy food, is a big concern. Um, I'd say options for safe and high quality early childhood care um, is a really big one. Same thing for elder care.
Hmm.
So many people that the families are doing everything they can to take care of them, but basically have to leave them alone while they work during the day, and kind of sketchy situations. Um,
Now,
I would say those would be the bigger priorities.
are there is violence a problem in your community, community violence, or is not?
Uh, no, it is. I mean,
Oh,
it definitely is as well.
mhm.
Maybe to a lesser degree than some of the
Or-
larger cities, but
mhm.
it still is. I mean, definitely, uh, domestic violence remains a big but sometimes more hidden problem, and then there's uh, so many issues with gun violence and um, other forms of community violence. Maybe not as much here as far as gangs, although that exists, but I'd say to a lesser degree than in some other places. But certainly it is an issue. Um,
Now,
and going along with that, just safe neighborhoods where people feel comfortable, walking and taking their kids to the park and things like that. So and safe and transportation actually is another huge barrier.
yes, that's
Um,
right. What about the environment, the community environment? And right now, one of the public health concerns is global warming and climate change, and you are basically on the U.S.-Mexico border. Is that a problem, for instance, in the summer? That do you see a lot of cases of dehydration or environment-related health conditions?
Yeah, I mean, actually, that's a great point that you bring up. I mean, it's not obvious on an individual level, but I agree that probably the number one thing really we should be addressing is climate change, because that's going to impact more people's health around the world than probably anything else we're talking about. It's hard to see. I mean, we certainly see dehydration more. You know, I have a lot of patients that are construction workers, and certainly they are at risk, and just older adults working in their yards or things like that, or walking to the bus stop is a common thing that, you know, people have a hard time in the summer staying at bus stops without shade, or even getting to the bus stops in the first place is a risk. On the border, I mean, we don't end up seeing these patients necessarily, but certainly many people are dying coming across the border in the desert from heat and dehydration. And there are a lot of other groups locally working on that, really from an activist perspective. And there is a free clinic that's really kind of an intermediary between a lot of the border activist groups and the care we provide, that sees it's a free clinic, but primarily the patients they see are people who have crossed recently or are, you know, afraid to come to our health center, even though we never obviously turn people in or try to even ask those questions, but, you know, people still feel unsafe sometimes. So this other free clinic is where a lot of those people go. So they're a lot more likely to see the acute dehydration and things like that. And we try to collaborate with them, like when they have people who need more services, that will, you know, get them in right away and things like that. But I think those things are certainly happening. They're just not showing up at our health center.
You know, the other topic that I believe is closely related to these heat waves is the incidence of diseases that are mosquito-borne. You know, there is also a concern of these Zika virus infection and chikungunya fever and dengue fever. So probably that is a topic that I believe everybody is going to benefit from discussing. If you agree, I believe that this is something that we are going to see more cases in the future.
Yeah, I definitely agree with that. And we haven't seen cases that have been transmitted directly here, but certainly we have the chikungunya, which I can never pronounce right. We've had cases in Sonora, Mexico, so you know, definitely crossing over with a lot of our patients go back and forth.
Okay, and the last question in regards to the activities for the next program year is I've seen there is a lot of activities going on, specifically in the community, the clinical community, clinical staff community, about the use of some of the electronic communication channels, like the patient's portal, the EHRs, and all that stuff. And the question that I have for you is, do you think that is a topic for discussion on how others are using either social media or portals to increase access to care?
Oh yeah, I think that would be great, because it definitely has potential to be a useful tool, and at the same time it's being required by meaningful use and other agencies that are really pushing it. So we're trying to meet those outside targets that are pushing us, and so it's a matter of how do we meet those targets and make it really be beneficial to patients and for efficiency, and to, like you said, to expand access. I think it does have a lot of potential, but needs a lot of work, because the out-of-the-box products don't just work by themselves. So you really have to do a lot of workflow to make them effective. So yeah, that'd be great.
But in your...
And the e-visits, which we're starting to dabble in some, but I think there's a lot more potential for that. So I think e-visits would be part of part of that conversation.
Okay. Okay. Excellent. Thank you so much for this advice and feedback. We are going to use it. We are in the process of developing the work plan, and I believe that these are topics that we can discuss the next following year. So thank you so much. Now,
Oh, sure. Thank you.
now in regards to cervical cancer, now diving into the topic, I just have some quick questions for you. We are planning to get all these ideas and share what we are gathering from the group and do a publication, and put all these recommendations and best practices on our website once we are done with all these calls. And the other day, probably about 2 months ago, we discussed some strategies to reduce the risk of HPV infection. Um, the question that I have for you, and this is a follow-up question, is does El Rio provide sexuality education for boys and girls, specific or condom promotion and education?
So up until now, we've had the education piece has really been done just individually in the clinic, and I'd say with pretty mixed results, just depending on the provider and their capacity for doing that, and then the clinic workflow, how much time they have, all those kind of things. And for condoms, I mean, we do have through our pharmacy, we have a standing order, so anybody who requests them can get them. So those are available, but people have to know, teens have to know to go to the pharmacy and request them. They don't have to have a prescription. And we do have them available in some of our clinics, again, kind of depending on the activation of the individual provider, whether they're giving those out or not, and probably a little bit harder to access. But I think that's really changing with the work that Joy Baines is doing. So she's the one that I was trying to connect you with. So she is going to be starting some adolescent group visits and having kind of the entryway to that. She's calling them pizza protection parties, but really having it youth-led, so training some at-risk youth on her Youth Leadership Council to facilitate that education in those meetings. So really having like a half hour, the idea to have just kind of a fairly brief presentation and discussion around the different options, and then followed by visits with providers right at the same time, so then they can get whatever method they prefer fulfilled or ask further questions, and then also do more of using text visits. So she's really set it up so these at-risk youth or anybody can actually text a provider and have a conversation around whatever reproductive health issue they have. And also as part of that, there's also a text information line where, and I think it hasn't actually rolled out yet. She's done this elsewhere. I forget where she did it, some other city before, but it's going to be where people can just text like, I forget what the text is, but anyway, they just text like the word and to this text line, and then they get a choice of different topics that they want to learn about, and then it gives them like a recorded message on that or further information, and that's available 24 hours, of course. So trying to use some, to actually do more of the traditional informational sessions, but then also use some of these new tech tools to accomplish the same mission.
Now, is there any work in the community, for instance, outreach workers addressing this issue, or do you work with the schools that are nearby, or any other kind of education in the community?
Well, for many years, for I think probably about 15 years or maybe even longer, we actually had a midwife based at one of the high schools. And she would do reproductive health and also prenatal care for the pregnant teens, and then kind of post delivery support of those moms. But about maybe 2 years or so ago, one of the parents was somehow got concerned about this, that they were, I think, I forget now, actually, it's all become fuzzy in my mind, but I think they were concerned that like their child had been tested for chlamydia and gonorrhea, and was really upset about that and went to the school board, and it became this big, huge issue. And basically the school board determined, their lawyers determined that it was potentially illegal that we had this school-based clinic. And so the whole thing got dissolved, which is really unfortunate from one upset parent. So we're pretty hesitant as far as working with directly in the schools, so trying more to collaborate. But the health department, the Pima County Health Department, does send a mobile unit out to some of the schools, and that is slightly different because they're not actually in the school, but it's parked. It's like one of these big van things. It's parked in the parking lot, and the teens can go to do that, but not the school, like within the school. So far that has been, and that's actually a different school district in the same area, but a different district. So far that's still happening as far as I know. And there's, I think those are the main groups. As far as I know, there's not a whole lot of other community groups doing this work.
No, but this is great. This is great information. And
yeah.
I also would like to move on and ask you some questions about secondary prevention. And probably this is something that, because of the geographical area where Rio is located, you may see some patients that have or have not received the HPV vaccine. Probably you may see some cases of pre-cancerous lesions. If someone identify a patient, a female patient, with a cervical lesion, do you provide treatment at the clinic, or do you have, and depending on the severity of the lesion, whether you have some agreement with hospitals or OB/GYN clinics?
So we have our own OB group at El Rio, so we basically refer everyone to them, and then they will work on a sliding fee scale with them to provide treatment. So fortunately for us, it's pretty easy. I think, I don't think people slip through the cracks very often. There might be some who somehow never make that transition, but I think we manage them pretty carefully.
Mm-hmm. Mm-hmm. Okay.
And the nice thing is we share the same EMR too. So then, if somebody isn't following up with the OB and they come back for their cold or whatever, we can see that they still need that, and really try to encourage them and follow up with them and help get those appointments and things like that for them.
Okay. Now, do you have some kind of prevention service integrated? I mean, if you have, for instance, education on HIV, or if you offer the HIV testing, I'm not sure if you use the opt-out strategy.
Yes, but we do, and so we don't necessarily do a lot of like community outreach education kind of thing, but we did a whole quality improvement project on this about over a year ago, maybe a couple years ago now, and really put into our care guidelines, which is what drives our offering of preventive services, or at least once and sometimes yearly, depending on the patient, testing for HIV in an opt-out manner, and that has dramatically increased our rates. So that really is being done routinely, along with Hep C for the appropriate age group. Mm-hmm. And then we do have our own Ryan White funded HIV clinic, and so they really see all of our patients who have HIV, and they do more of the partner education, things like that.
Okay.
I'd say they drive most of that.
This is great information. And the last question that I have is, do you have or do you offer mobile services, for instance, breast cancer screening and cervical cancer screening. Some health centers have these units going to the community and providing mammograms and cervical cancer screening. Do you offer that service?
We don't have mobile mammography. We have that at our health centers only. We do have an outreach team that goes out to various homeless shelters, substance abuse, inpatient treatment facilities, transitional housing, those kind of places. And they do primary care. So it's not an emphasis on cervical cancer screening, but we definitely do try to include that for anybody who needs it. And it depends on the site. Like some of the sites is literally like the broom closet. I mean, not as an exaggeration, like they're really in pretty minimal. Like this one place, it's like the living room table where everyone is seen. So at those sites, they don't do the cervical cancer screening, but they really work to get the patients into the health centers for that, even if they're getting most of their primary care at the outreach site. So, we did at one point several years ago have we're in partnership with one of the local hospitals. We had a mobile, again, one of these big mobile RV kind of things that was like a clinic that would go out to sites. And that ended up, of course, the grant that sponsored it through the hospital dried up. And then it just wasn't, they weren't seeing enough patients to make it sustainable. And the cost of the driver and the van itself, really didn't make sense, especially being that we're in an urban area and it's not really, it wasn't really, necessarily that much further for people to go to one of our health centers.
Mm-hmm. No, this is interesting. Thank you so much, Dr. Margaret. And now,
Oh, sure.
The other thing that I wanted, well, first of all, I would like to thank you for the introduction, the email that you sent the other day. I'm planning to follow up to see if I can also talk to the person that you introduced me to. And the other thing that I needed to talk to you is about our next diabetes call. I've been talking to some of my NCA colleagues, and we would like to talk a little bit about staff, whether you have the right staff and the right number and size. So we are planning to have this conference call. Probably the date is going to be February the 21st. So I'm not sure if you are available to join us. We would love to have you on the call. We get excellent feedback from you.
Okay. I'm not sure. That's actually, Tucson has a weird holiday, which is rodeo holiday, which is on that date. And I'm currently scheduled to be off, but I may be around. I'm not really sure. So it's probably not the best date for me, but I might possibly be able to make it work.
What I can do is that I'm gonna send some dates, so you can either select that week or the week after, the week of the 26th, and then we can accommodate your time and your availability.
Oh, that sounds great. Excellent.
All right. And so, well, thank you so much for all this information, Dr. Margaret. This is really, really, really good for us, and to listen what you are doing and that Rio is doing is fabulous for everybody. So I believe that we are gonna get a good publication and some good information that we can share with the other health centers. So thank you so much.
Sure thing. Thank you.
Thank you and have a great day.
Okay, you too. Bye-bye.